All right, everyone, let's dive into a topic that might be a little bit, well, delicate for some.
Yeah, no sugarcoating here, right. We're tackling anorectal and prostate exams today.
Exactly. But hey, as nurses, these exams are a crucial part of what we do, so we got to get comfortable with them. And that's what this deep dive is all about. We've got diagrams, step-by-step guides, all sorts of resources to help us break it all down.
Absolutely. And, to do these exams well, we need to have a good grasp of the anatomy first. It's like you wouldn't set off on a road trip without a map, right?
Makes sense. Got to know the lay of the land. So let's get oriented. We're talking about the rectum, anal canal, and for our male patients, the prostate. What are the key landmarks we need to have in mind? I see we've got some diagrams here.
Yeah, these diagrams are super helpful. So let's start with the anal canal. One important thing to remember is that it's not straight up and down.
It's at an angle.
Yep. It's at an angle, which is something to keep in mind during the exam. And unlike the rectum, the anal canal is packed with sensory nerves, meaning it's really sensitive. Gentle touch is key here.
Right. Got to be extra careful there. No one wants a rough exam, and I imagine it would make it harder to get accurate findings if the patient's tense. So what else should we know about the anal canal?
There's this crucial transition point called the anorectal junction, or the pectinate line.
Okay, the anorectal junction. What's so special about it?
Well, it marks the change from the skin of the anal canal to the lining of the rectum. Different tissues, different nerve supplies. And that's important because it helps us understand why some problems in this area can be really painful.
So that's why some conditions are more uncomfortable than others. Makes sense. All right, what about the prostate? Where does that fit into the picture?
So picture this, a walnut-sized gland sitting right below the bladder, wrapped around the urethra.
Okay, I'm picturing it.
That's the prostate. During the exam, we're feeling its backside through the front wall of the rectum. You're mainly feeling for the two lateral lobes and the median sulcus. That's like a little groove running down the middle.
Got it, 2 lobes and a groove. And this is only relevant for male patients, right?
Exactly. In women, you might feel the cervix through the rectal wall, but there's no prostate to examine.
Right. Makes sense. Now that we've covered the basic anatomy, let's shift gears a bit and talk about what our patients might be experiencing. What kinds of symptoms should send up red flags for us as nurses? What should we be listening for?
Changes in bowel habits are always a big one. We're not just talking about constipation or diarrhea here. It's about asking about any changes in the frequency, consistency, or color of their stool.
Oh, right. Those details matter. For instance, I remember reading that if a patient describes their stool as pencil thin, that could be a warning sign of colon cancer.
Exactly. That's definitely something to watch out for. And blood in the stool can also be a sign of something serious.
Speaking of blood, can you remind us what the different blood colors might indicate?
Sure. Bright red blood usually means the bleeding is coming from lower down in the digestive tract, like from hemorrhoids. Darker maroon-colored blood might mean the bleeding is higher up. And then black, tarry stools, those could signal bleeding in the upper digestive tract.
So the color can give us a clue about where the problem might be. What other symptoms should we be asking about?
Pain during bowel movements is another important one. We need to ask about the type of pain, whether there's any discharge or bleeding, any itching or soreness around the anus.
Like, for example, pain with pus-filled discharge or bleeding could point to proctitis, right?
Exactly. Inflammation of the rectum.
And I remember reading that proctitis can have a whole bunch of different causes, from inflammatory bowel diseases like Crohn's or ulcerative colitis to STIs.
You got it. It's crucial to consider all the possibilities.
For sure. What about anal warts and fissures?
Right, those are important too. Anal warts, those are small growths caused by HPV, and fissures, those are tears in the lining of the anus.
Ouch, those sound painful.
They can be, and they can also be related to conditions like Crohn's or STIs.
Okay, so we've talked about changes in bowel habits, pain with bowel movements, anal warts, and fissures. What about men specifically? Any prostate-related symptoms we need to know about?
Definitely. A weak urinary stream is a common one, especially in older men. This is often due to BPH, where the prostate enlarges and squeezes the urethra, making it harder to pee.
I can imagine that's super frustrating, like trying to drink a milkshake through a coffee stirrer.
That's a great analogy. Along with a weak stream, they might have trouble starting or stopping urination, feel like their bladder isn't emptying completely, or have to go more frequently, especially at night.
And these symptoms could also be a sign of something more serious, like prostate cancer, right?
They could, which is why it's so important to take a good history and perform a careful exam. Another thing to look out for is acute prostatitis.
Prostatitis, that's inflammation of the prostate, right?
You got it. It comes on suddenly and causes fever, chills, lower back and groin pain, and painful urination.
So paying close attention to these symptoms can really make a difference in our patients' lives. Now that we've covered the common symptoms, let's move on to the actual examination. What are the essential steps involved?
Well, before we even touch the patient, we need to make sure they're comfortable and understand what's going to happen. Clear communication is key. Then we can position them either lying on their left side with their knees bent, we call it the left lateral decubitus position, or standing and bending over the exam table.
So we choose a position that works best for both the patient and us as examiners. And good lighting is probably important too.
Oh, absolutely. Good lighting is crucial. We'll start by looking at the area around the anus, checking for anything out of the ordinary like redness, swelling, or discharge.
So we're connecting what we see with what we know about the anatomy. What are we looking for specifically during this visual inspection?
We're looking for signs of hemorrhoids, fissures, or skin breakdown. Hemorrhoids might appear as swollen, bluish lumps, especially if they're thrombosed, meaning a blood clot has formed. And fissures would look like little tears or cracks in the skin.
Okay, so we're doing a careful scan for any abnormalities? Then what?
Next comes the digital rectal exam, or DRE. This is where we gently insert a lubricated, gloved finger into the anal canal to feel for anything unusual.
This part can be a little anxiety-provoking for patients, so explaining the process clearly and being gentle is super important.
Absolutely. And as you're inserting your finger, pay attention to the anal sphincter tone. It should feel firm and close around your finger. If it's too tight, it could be from anxiety, inflammation, or scarring. If it's too loose, it could point to a neurological problem.
Wow, so even the sphincter tone can give us valuable information. What do we do after assessing the sphincter?
You gently rotate your finger to feel the entire rectal surface, paying attention to any masses, lumps, or areas of tenderness. If you need to bring a lesion within reach, you can ask the patient to bear down as if they're having a bowel movement.
Makes sense. We're basically feeling for anything that shouldn't be there.
Mm-hmm.
And for men, we also examine the prostate during this part of the exam, right?
Right. For the prostate exam, you'll adjust your hand position so you can feel the prostate through the front wall of the rectum. You'll be assessing its size, shape, consistency, and mobility. Just let the patient know that it's normal to feel the urge to urinate during this part.
Okay, so we've talked about the visual inspection and the DRE. What comes next?
Documentation. It's important to record our findings clearly and professionally. We can use full sentences or concise phrases, but the key is to be accurate and thorough. For example, for a normal exam, you could write, no visible lesions or fissures, external sphincter tone intact, rectal vault without masses, prostate smooth, symmetric, and non-tender with a palpable median sulcus, stool brown, no fecal blood.
That's really helpful. Clear and concise. Exactly what we need.
Right.
I'm curious, is there anything else we should keep in mind when performing these examinations?
Always remember that these exams can be sensitive and uncomfortable for patients. It's super important to be empathetic, respectful, and communicate clearly throughout the process. And of course, make sure to dispose of your gloves properly and wash your hands thoroughly afterward.
Excellent points. It's all about providing compassionate and safe care. We've covered a lot of ground in this first part of our deep dive, from anatomy to symptoms to examination techniques.
And in the next part, we're going to delve into the complex world of prostate cancer screening, exploring the benefits, risks, and ethical considerations involved.
Sounds like a fascinating discussion.
Yeah.
Stay tuned, listeners. We'll be back in a moment to continue our deep dive into anorectal and prostate examinations.
All right, welcome back, everyone. Now let's shift gears a bit and talk about prostate cancer.
Definitely. It can be a sensitive subject, but you're right. We need to be comfortable discussing it. So what are the key things we need to know?
Well, first, it's important to understand just how common it is. It's the most common non-skin cancer in men and the second leading cause of cancer death. About 1 in 9 men will be diagnosed with prostate cancer in their lifetime.
Wow, those are some pretty sobering statistics. It really highlights why we need to be knowledgeable about it, both for ourselves and for our patients.
Exactly.
So what are the risk factors? What makes someone more likely to develop prostate cancer?
Well, age is a big one. Prostate cancer is rare before the age of 40, but the risk goes up significantly after 50.
Okay, so age is a factor. What else?
Ethnicity also plays a role. African American men, unfortunately, have a higher risk of developing and dying from prostate cancer compared to other racial groups.
That's important to remember and something we need to be aware of when assessing a patient's risk.
Right. And, of course, family history is a factor, too. If a man has a father or brother who had prostate cancer, his risk is increased.
Okay, so age, ethnicity, and family history. Those are all important things to consider. What about prevention? Is there anything men can do to lower their risk?
That's the million-dollar question. Unfortunately, there's no magic bullet when it comes to prostate cancer prevention. Unlike some other cancers, there aren't any proven lifestyle changes or dietary supplements that can definitively prevent it.
So no specific diet or exercise regimen that's been shown to make a difference?
Not that we know of yet, but research is ongoing.
Okay, so what about screening? I know the PSA test is commonly used, but I've also heard there's some controversy surrounding it. Can you walk us through that?
Sure, the PSA test measures the level of prostate-specific antigen in the blood.
PSA, okay.
Yeah, elevated PSA can be a sign of prostate cancer, but it can also be elevated for other reasons like BPH or prostatitis.
So a high PSA doesn't automatically mean cancer.
Exactly, it's not a perfect test, and that's where the controversy comes in. There's concern about overdiagnosis. That means finding cancers that would never have caused any problems if they hadn't been detected.
So a man might undergo unnecessary treatment for a slow-growing cancer that wouldn't have harmed him.
Exactly. And the treatment for prostate cancer, like surgery or radiation, can have significant side effects like incontinence or erectile dysfunction. So the decision to get screened is not a simple one.
It sounds like there's a lot to weigh when considering PSA screening. What's the current recommendation? What do the guidelines say?
It's not so straightforward. There's no one-size-fits-all answer. Major health organizations have guidelines, but they don't all agree on the age to start screening or how often to screen. It can be confusing, even for us healthcare providers.
Yeah, sounds like it. So what's the best approach for us as nurses? How do we navigate this with our patients?
Shared decision-making is key. We need to have open and honest conversations with our patients about the potential benefits and risks of PSA screening. It's about helping them understand the complexities and supporting them in making a decision that aligns with their values and preferences.
That makes a lot of sense. Each patient is unique, and their personal circumstances should guide the decision. Are there any resources we can use to help facilitate these conversations?
There are some really great tools called decision aids. They provide information about prostate cancer, the PSA test, and the potential benefits and harms of screening and treatment. Some even include videos or interactive exercises to help patients really understand the information.
That sounds helpful, both for patients and for us as providers. Where can we find these decision aids?
Many reputable organizations offer them online or in print format. You can find them on websites like the American Cancer Society, the National Cancer Institute, and the Prostate Cancer Foundation.
Awesome. I'll definitely be checking those out. So, to summarize, prostate cancer is a serious disease, but the decision to get screened is a personal one that should be made through shared decision-making.
Exactly. And our role as nurses is to provide accurate information, answer questions, and support our patients in making the best choice for them.
I agree. Now, I know you mentioned earlier that there's some research on medications that might help reduce prostate cancer risk. Can you tell us a little bit more about that?
Sure. There's a class of drugs called 5-alpha reductase inhibitors, or 5-ARIs, that have shown some promise in reducing the incidence of prostate cancer. These medications are primarily used to treat BPH, but some studies suggest they might also have a preventative effect.
So these medications are already being used for another purpose, and there's a possibility they might have an added benefit. That's interesting.
It is, but it's important to note that the evidence isn't conclusive. More research is needed to determine if the benefits outweigh the risks. And remember, the FDA doesn't currently recommend using these medications solely for prostate cancer prevention.
Okay, so it's a promising area of research, but we need more information before making definitive recommendations. What are some of the things researchers are looking at?
Well, they're studying different types of 5-ARIs, different dosages, different lengths of treatment to see what works best and what the long-term effects are. They're also looking at whether these medications are more effective in certain groups of men, like those with a family history of prostate cancer.
So there's still a lot to learn, but it's encouraging to know that researchers are actively working on finding new ways to prevent and treat prostate cancer. Is there anything else we should know about 5-ARIs?
It's important to be aware of the potential side effects. These can include things like decreased libido, erectile dysfunction, and breast tenderness.
Oh, wow.
Yeah, these side effects are usually reversible when the medication is stopped, but they can be bothersome for some men.
That makes sense. So, as with any medication, it's important to weigh the potential benefits against the risks.
Absolutely. And that's why having these open and honest conversations with our patients is so crucial. We need to provide them with all the information so they can make informed decisions about their health.
I couldn't agree more. Now that we've covered the complexities of prostate cancer screening and prevention, let's shift our focus back to the actual examination techniques. In the next part of our deep dive, we'll walk through the step-by-step process of performing an anorectal and prostate exam. Welcome back, everyone. We're ready for the final part of our deep dive into anorectal and prostate examinations. We've talked about the anatomy, symptoms, and the importance of prostate cancer screening. Now let's walk through the actual exam.
It's like putting all the pieces together. We've got the map, the clues, and now it's time to see what we find.
Exactly. So let's say we have a patient who's experiencing rectal bleeding. What are the first things we do?
First things first, we got to make sure our patient is comfortable and knows what's going to happen. We can position them on their left side, knees bent. That's the left lateral decubitus position, or standing, bending over the exam table. Whatever works best for the patient and gives us good access.
So communication and comfort are key.
Absolutely. Once the patient's positioned, we start with a visual inspection of the area around the anus, looking for any abnormalities, redness, swelling, discharge, anything unusual.
It's like we're detectives looking for those telltale signs. What are some things that might raise a red flag?
Hemorrhoids are common. They might look like swollen, bluish lumps, especially if they're thrombosed. We'd also be looking for anal fissures, those little tears in the skin, and any areas of skin breakdown or irritation.
So we're carefully observing, connecting what we see with what we know about the anatomy and the patient's symptoms.
Exactly. And then comes the digital rectal exam, the DRE. We gently insert a lubricated, gloved finger into the anal canal to feel for any abnormalities.
Again, clear communication and gentleness are super important here.
Yep.
We've got to make sure the patient feels safe and comfortable throughout the process.
You got it. As you're inserting your finger, you're also assessing the anal sphincter tone. How does it feel? Tight, loose, painful. A tight sphincter could mean anxiety, inflammation, or scarring, while a loose one might suggest a neurological problem.
It's amazing how much information we can get just from feeling the sphincter tone. So what's next?
Next, you gently rotate your finger to feel the entire rectal surface. You're feeling for any masses, nodules, irregularities, or areas of tenderness. If you need to, you can ask the patient to bear down like they're having a bowel movement to bring a lesion within reach.
Makes sense. We're feeling for anything that shouldn't be there. And for our male patients, we also need to examine the prostate.
Right. To examine the prostate, you'll adjust your hand so you can feel it through the front wall of the rectum. You're assessing its size, shape, consistency, and mobility. A normal prostate feels rubbery and smooth, like a walnut.
And if we feel any hard or lumpy areas, that could be a sign of trouble, right?
It could be. It's important to note any abnormalities and discuss your findings with the healthcare provider.
Okay, so we've done the visual inspection and the DRE. What's the final step?
Documentation. We need to record our findings accurately and thoroughly. We can use full sentences or concise phrases, but it needs to be clear and professional. For example, we might write, no visible lesions or fissures, external sphincter tone intact, rectal vault without masses, prostate smooth, symmetric, and non-tender with a palpable median sulcus, stool brown, no fecal blood.
That's a perfect example of concise and professional documentation. Now, before we wrap up, any other pearls of wisdom for performing these exams?
It's all about being sensitive to the patient's feelings. These exams can be uncomfortable and embarrassing, so make sure to be respectful and provide reassurance.
Absolutely. Clear communication, a gentle touch, and compassion can make a world of difference for the patient. Well, listeners, that wraps up our deep dive into anorectal and prostate examinations.
We've explored a lot today, the anatomy, those subtle landmarks, and the intricacies of prostate cancer screening.
We've also highlighted the vital role nurses play in providing compassionate and informed care. Remember, these exams are crucial for our patients' well-being.
And as always, continuing education and practice are key to providing excellent care. So keep learning, keep asking questions, and keep striving to be the best nurses you can be.
And until next time, keep learning and keep caring.